the thing that happened with the mushrooming of counseling services, support group services for mental health during the pandemic, I think also opened the floodgates for the lack of the ethics of care. Kasi walang regulation eh. DOH is not on top of it. The Professional Regulation Commission is not. No one is regulating the space. Well, I think the first thing that we really learned, and I guess we knew it when we started the organization, was that telemental health is here to stay. Now, even if patients and doctors would prefer to do face-to-face, there is still room for growth to doing tele. Evidence has also shown that the results of doing telemental health or counseling over not face-to-face but virtually, or doing assessments for patients virtually, would have the same results as face-to-face. So that's one. The second is there is still a lot of room for expansion because there are gaps in the system. I think if you're talking tele, one of the huge gaps is there's no one that's providing acute or emergency services via tele. So that's a space in the virtual telemedicine firmament that can actually be addressed. Emergency care for mental health problems is still left to the hospitals and emergency rooms. So I think that if LAUNCHPAD is wanting to talk to startups and entrepreneurs who are interested to get into this kind of work, then that would be an open avenue at this time. Kasi gap yun eh. Infotech and biotech will still be growing. Eh. It's something that we should watch because that space is going to change. Kasi yun yung yun yung trend for future healthcare. I think if you look at it, populations will always grow faster than the number of people who are trained to become health professionals. Like how many doctors do we graduate every year in our country alone? We grow by 1 million to 1.5 million in terms of general population every year, but we're only able to license 1,500 doctors every year. So we are not growing our health professionals in the same geometric growth that the population is growing. So that will always be a gap. So if you're going to think about closing that gap, then you have to be very creative in setting up the program. And so I think that's an upside during the pandemic kasi suddenly it became real to a lot of people that isolation can really make you feel bad. And if you're left alone and not able to go out of the house to do the things you used to do, it can really make you feel low. And you will not be able to sleep. You will have no appetite, you know. So it became very real. Ang nangyari lang nun, because everything could be done virtually, diba? Instagram and TikTok, there were so many short reels giving tips, what is anxiety, what to do about it, if you can't sleep, yung mga ganyan. So may upside and downside yan. But the problem with that naman is misinformation. So you really have to check your sources, to everyone who's out there. Madaming aspects about tele kasi that we need to look at, but more than just talking about tele, I think what we need to understand is why we do what we do. No, I'd like to I don't want to talk about telemental health simply from the business perspective, because I think it is not a business. I think it's really at its very core is a service. And the challenge to anyone going into this kind of space is matching the need to address the needs of the patients, and then making it work from maybe a financial sustainability. So it's not very different from running a clinic or running a hospital. You have to be able to understand how to make the process or the service run efficiently with very good results, and at the same time make it sustainable. So I'm really talking about sustainability more than anything else. Kasi, we won't this space if we're not sustainable, di ba? So I think that's what we need to understand. The thing that happened with the mushrooming of counseling services, support group services for mental health during the pandemic, I think also opened the floodgates for the lack of the ethics of care. Kasi walang regulation eh. DOH is not on top of it. The Professional Regulation Commission is not. No one is regulating the space. There are no rules that govern it. So I think the consumer, it's not a very nice term, but the patients or the carers would have to be very clear that they have to do some research on the providers, and to be sure that they are licensed and credible, and that also what's the batting average, what are their outcomes, and also to pay attention to what kind of platform is being used because of the issues of confidentiality and privacy. Not all the platforms are safe. No? How are your records going to be kept? Who will store it? How long will it be stored? How is your identity kept? No, these are things that people have to be very aware of. It's like buying anything online. Online shopping also boomed during the pandemic. Pero di ba, even if you were buying something online, you would still research about it. Titignan mo kung legit yung nagbebenta. Titignan mo kung hindi fake yung item na binibili mo. More so with health, and much more so with mental health. Not everyone who offers mental health services can actually legitimately offer it, I think. And that's why people have to do the research. And more so with psychological and psychiatric care, kasi a lot of things hinge on it now eh. Like in the Philippines, for example, and from our own experience, employers ask for fit to work certificates. Schools ask for fit to enroll certificates. It gives the mental health professionals so much power over people's lives. And so I am very, very passionate about insisting that there must be ethics of care. We have to understand why we do what we do.